Patient Safety Day in Medistra by acknowledging our low infection rate for COVID among staffs. So during February until end of October, our staff infection rate is below 5%. And it's been hard work so far to maintain our safety behavior during this time around. So we pay tribute to our staff by giving them assurance through safety and security that they will receive the safest practice in delivering services. We also give them security and emotional support by held a regular meeting for each unit to know how we could support them better during this pandemic. Because health workers is our frontline assets, especially in this pandemic. And they need to be safe and secure first before delivering any services, because we need them as our front lines at all times. A culture of safety described as the core values and behavior that come about when there is a collective and continuous improvement and commitment. So safety culture is a very big concept with numerous activities. And to successfully implementing this concept, it needs a huge driven power. So getting everyone on board with this concept is definitely a continuous journey, which usually took a while for the organization. And this is why some organizations are still struggling with safety culture worldwide. So we had a very good campaign for health worker safety nationwide, together with the Ministry of Health and WHO Southeast Asia region, and asked health workers nationwide to speak up and raise the issue to the hospital management upon any conditions that may cause harm to hospital staff. Creating the awareness for everyone, especially for the health worker safety around nationwide in Indonesia, will be a very good call. Because with these increasing numbers of COVID cases and increasing number of deaths in our healthcare workers, I think this is a priority for the Ministry of Health and for Indonesia, to wake up and start to speak up for themselves that they have any issues, if they have any issues with any harm or any conditions that may harm. It would be good if the accreditation agency and the hospital management and the individual healthcare workers should go hand in hand to create an impactful program together. So overall, I think the need to create awareness for healthcare worker safety starts from the individual itself, where they need to speak up upon any circumstances that may cause harm. This is the key to engage to the hospital management to pay attention to the situation and improve. And when this awareness is already there, the accreditation agency could offer a consecutive training program to give hospital and update resources and prevention and control on infections. And I think it's already done in Indonesia so far. So we manage the safety risk during this pandemic from the clinical aspect and from the facility aspect. From the clinical aspect, our COVID-19 management team will make sure that all patients are given the best treatment possible to prevent mortality and complications for comorbid factors. For the facility risk, we're adding a specific zoning for COVID and non-COVID patients throughout the hospital. And then additional area for donning and doffing is maintaining the availability and providing a PPE for all of our staff.
Right.
On February, when this pandemic arose, I built one-line communications in the hospital, especially from the management to the senior level of the doctors and professors and all the staff. We are going to use this one specific communication line. So the information is same. Everyone has the same information throughout the hospital. So I think that's the most important thing. There is emergency preparedness, because
Right.
there has to be one solid command. So the digitalization will be the game changer. Our situation give a major transformation for the digitalization process in healthcare, more than we could imagine. And overall, it pushes us over the boundaries to make us give the better delivery process or in healthcare services, both for on-site and online. The one of the legacy of COVID-19 is the major transformation in digitalization in healthcare. And I think it will outlive the pandemic. And from management sides, I think the integrated telehealth come with the capabilities of boosting data gathering, referring to the artificial intelligence, and reporting efforts for clinical care, as well as enhancing workflow management.